So Kerry Litman, who is a partner emeritus at Kaiser Permanente, and I are going to do a role play. We have found this to be effective in communicating kind of all the emotion around the anxiety that clinicians have. In order to do this, we're going to intentionally set up our two characters. I'm going to be the OpenNotes skeptic, the bad guy, if you will. Kerry is the good guy. And now let me just make sure you know that Kerry really is a good guy. He played a major role in getting OpenNotes implemented at Kaiser, Southern California, and has really been a champion of patient and family advisory committees. So he is a terrific guy. Now, having said that, let's start. Next slide. So, Kerry, I see millions being spent on the electronic health record, and now OpenNotes is added to it. This is just going to cost us so much money.
John, this is Kate. Do you want me to jump in while we wait for Kerry to figure out his technical glitch?
Sure. Go ahead.
Okay. Well, John, what we can say about the cost is that the technical costs are relatively small. Most EHR vendors already offer this most of the major vendors already offer this functionality, so it's just a matter of flipping that switch. There is some cost related to sort of the political capital you need to use as you're rolling it out and talking to your clinicians. And if you want to put together materials for patients and providers, there is some cost, but it's compared to other interventions in the healthcare system, OpenNotes is a low-cost intervention.
And can you hear me now, John?
We've got Kerry. Okay,
I will cede my time to Dr. Litman.
Well, so Kerry, we're on the second issue here, and I just want to tell you, I'm working too hard already, and it looks like this OpenNotes thing, I'm going to have to work even harder, have more messages, phone calls, and complaints. I'm just too busy for this. Yeah.
So, John, while clinician burnout is a real issue, our research and reports from over 160 other implementers show that, in fact, email volume does not increase. Visits are not longer. Phone calls also show no change. About 15 to 20% of clinicians do need to spend some time making small changes to their notes to create more patient-friendly documentation, as Naomi mentioned. But even when they don't, there have been no big problems. The most common description of an OpenNotes implementation is, as you said, a non-event.
Well, I've got lots of specialty friends, Kerry, and I don't think they're going to like this. I mean, the oncologists, the urologists, the ear, nose, and throat surgeons, I don't think they're going to like this.
Well, again, our research shows that patients receiving care, regardless of their specialty, experience the same benefits and desire access to their notes as much as patients getting care in other specialties. Mental health clinicians are more anxious, but the data for benefits is similar. Adolescent care physicians are anxious, and sharing notes with adolescents can be tricky because there are local regulations that can affect that. But many organizations have succeeded here too. There's no consistent specialty pattern. We know of OpenNotes champions who've seen a benefit of sharing notes in every specialty.
Well, that's reassuring, but, some of our physicians, our clinicians are poor documenters, and it's going to be embarrassing for them, for a patient to read those notes.
Well, it is true that in most organizations, 15 to 20% of clinicians write notes that are suboptimal and should make changes to their documentation approach to make them more patient-friendly. These changes are simple and easily implemented. For example, reducing unclear acronyms and pejoratives, using plain language when possible, and minimizing that dreaded copy and paste. Not surprisingly, these changes can also make the notes better for colleagues. Overall, we've been pleased to see that patients often learn a lot from notes, even ones that many of us think could be better. For most patients, it seems that something is better than nothing when it comes to viewing their clinician's notes.
Well, maybe you're right about that, but I'm skeptical. I think there's a lot of people who can't possibly understand the notes.
Well, given clinicians' many years of training and special expertise, this might on its face seem to be true. But in fact, 85 to 90% of patients report they can read and understand most or all of a note. Less than 10% report confusion. And thinking about it, confusion frequently leads to knowledge. We think confusion is preferable to ignorance, and that giving patients more information improves care.
Well, you're making a case, but I still feel like this is a bad idea. Why are we doing it?
Well, John, have you looked around us lately? The world is changing, and medicine needs to keep up, or it risks becoming irrelevant. Studies show that 99% of patients think OpenNotes is a good idea. They see the benefits and want the option of easy access to their notes. Think about what a clinician would want if they or a family member were ill. They would usually want to see their own or their family member's notes. Fair is fair.
Well, you're right about that, but you know, I could get sued here. I think this could just be easy information in terms of me getting a malpractice suit. I mean, give me a break.
Well, actually, we think it's more likely it will prevent or correct errors that could lead to bad outcomes, confusion, and the dreaded malpractice. A small but significant number of patients do see errors and ask for corrections, and they tend to trust the physicians that make these changes even more. So after 3 years of OpenNotes implementation at Beth Israel Deaconess, there was not any increase in malpractice cases, and I think that's been true as the general case throughout all the 170 or so practices that have implemented.
Well, I got to admit that's convincing, reassuring. But now I do have some colleagues that I think upcode, and when patients see that, they're not going to be happy, Kerry.
Well, no one's actually studied the idea of whether notes can be a way to decrease upcoding or inappropriate notes. If a clinician was performing upcoding, that's going to be noticed by their patients. And if clinicians have any sense, they won't do it. It's one outcome to be afraid of if you're not being honest. OpenNotes may be indirectly helping physicians avoid serious regulatory jeopardy.
Well, that was helpful. I'm going to have more of an open mind on this. Thanks. Thank you, Kerry, and thanks for that role play.